Evaluation on genotoxicity of Triphenyltin Dithiocarbamate compounds in Jurkat E61 acute lymphoblastic leukemia cell line. As in introduction, acute lymphoblastic leukemia is a hematologic neoplasm characterized by the clonal proliferation of lymphoid progenitor cells, both in the bone marrow and in extramedullary sites. Besides, chemoresistance is a major cause of recurrence and death from T-cell acute lymphoblastic leukemia, both in adult and pediatric patients. We were interested to develop a prospective anti-leukemic drug with lower toxicity and fewer side effects is due to the great divergence of leukemia patients' prognosis, whereby the survival rate is still low. Many studies have been conducted on organotin compounds towards various tumor cell types, and the result demonstrated that the organotin compounds are very effective as anti-tumor agents. The main focus of the project is to evaluate genotoxicity induced by triphenyltin dithiocarbamate compounds on Jurkat E61 cells, whereby our specific aims were to determine the phase of the cell cycle arrest induced by the interest compounds on Jurkat E61 cells. Second one is to determine DNA damage induced by the interest compounds on Jurkat E61 cells. Lastly is to compare the genotoxicity of the interest compounds in Jurkat cells. The methodology in this study led to the achievement of the main focus, started with two novel triphenyltin dithiocarbamate compounds, namely triphenyltin diisopropyl dithiocarbamate, which is compound 1, and triphenyltin diallyl dithiocarbamate, which is compound 2, where both compounds were induced on Jurkat E61 in order to identify the progression of cell cycle arrest via cell cycle analysis and to determine DNA damage via alkaline comet assay. The collected results were statistically analyzed using one-way ANOVA test. The results showed that at 4 hours, there was a dramatically reduction in the percentage of stent-treated cells in the G0 G1 phase. Meanwhile, there was a significantly increase in the ACE phase of the compounds-treated cells, including etoposide that were used as the positive control in this study. These findings suggest that both compounds were DNA targeted. According to Pucci 2000, the cell will undergo a repair mechanism and the cell will be blocked from entering G2M phase. If the cell cannot be repaired, apoptosis of the cell occurs, as most of the cell population is arrested at ACE phase for both 2 hours and 4 hours treatment. Only certain number of cells will undergo a repair mechanism and escape apoptosis will enter G2M phase. In conclusion, both compounds notably induce cell cycle arrest in ACE phase. These findings elucidate the cytotoxicity of triphenyltin dithiocarbamate compounds in Jurkat T lymphoblastic leukemia cell model via genotoxic effect, which warrants further investigation into its anti-leukemia efficacy. We would like to thank Malaysia Ministry of Higher Education for the financial support and Faculty of Health Sciences UKM for providing essential facilities to conduct this study. These are the list of references and thank you.